This story reflects one person's experience. Not every person will receive the same results. Bear in mind that all surgeries carry risks. This treatment is prescribed by your physician and is not for everyone. Please talk with your doctor and see if it's right for you. Your physician should discuss all potential benefits and risks with you. Important safety information about the X-Stop spacer appears at the end of this video. For additional information about this product and treatment options, please visit www.xstopspacer.com.
I'm not one that can sit for very long. I always find that I've always been happiest when I'm doing things. When I'm out hiking, even not just with the dogs, just constantly in motion.
55-year-old Kathy Bedore loves leading a very active life, not only as an outdoor enthusiast, but as an elementary school teacher.
Good morning, Maxton. How you doing, bud? I love teaching. I love being with kids. Hey, Carter. And teaching is a big part of my life. It's who I am.
For more than 15 years, Kathy struggled with chronic back and leg pain.
The pain was excruciating, enough that it would make me sick to my stomach. And it was very tough to just handle it.
Kathy was diagnosed with lumbar spinal stenosis, a degenerative disease that causes narrowing of the spinal canal. This narrowing pinches or compresses the nerves in the spine and causes painful symptoms, which often makes it difficult to walk or even stand. Like many LSS patients, Kathy's limited mobility made it hard to get through the day, both at work and at home.
I would work all day and then go home and kind of collapse on the couch. So the pain by the time I got home was pretty bad. I'm thinking, there's got to be more than this. There's got to be.
When Kathy's doctors suggested she undergo a traditional laminectomy to repair her spine, she refused.
For me, that was not an option. I did not want any part of that. I didn't want anybody touching my spine, and that's how it needed to be for me. And I decided to just live with it.
For years, Kathy tried physical therapy and epidural steroid injections, but the relief was only temporary. Then she turned to pain medication.
I reached a point that I was just literally living on that stuff. And I didn't like the way it made me feel.
Kathy's pain had a profound impact on every aspect of her life.
My life changed totally and completely because I could not do any of the things that I liked to do or had to do. It wasn't just the fact that I couldn't ski. It was the fact that I was having a hard time earning my living. You know what? That would be one of my favorites, too. I'm not the kind of teacher that can sit behind a desk and teach. I have to be up and moving. Only one. And it was very difficult to do. I knew that something had to happen.
Hey, Kathy, how are you?
I'm doing well, and you?
Good to see you.
Kathy turned to Dr. John Herzog, an orthopedic spine surgeon, for help.
Internally, in the spinal canal, the nerves get pinched, and that's why you're having the nerve pain.
Dr. Herzog thought Kathy would be a great candidate for an innovative procedure called the X-Stop.
It's just a stop, like a door stop on a door. It just keeps the spine from going into extension at the spot where your nerves are pinched internally.
X-Stop is a simple device that stops the terminal extension that occurs in our spine when we stand and walk.
The X-Stop is implanted between the spinous processes and is designed to keep this space open. So when a patient stands up, their nerves are no longer pinched. And a key benefit for Kathy, the X-Stop spacer is a less invasive surgical procedure.
It's in there just with pressure. There's no plates, there's no screws. And I'm thinking, wow. So I signed me up.
After a short recovery, Kathy was back living a very active lifestyle.
I'd had that excruciating pain for so many years. And then to all of a sudden get up one morning and it was literally gone. It's all set, ready to rock and roll. It was totally an unbelievable moment. And I don't think I'll ever forget that day.
While Kathy received satisfactory results, it's important to note that all spine surgeries carry risks. The X-Stop spacer may not be right for those with certain allergies, spinal anatomy, or severe osteoporosis. Approximately half of patients studied achieved treatment success. Most importantly, Kathy can now enjoy one of her greatest pleasures in life, teaching.
I'm reinvigorated. I can squat down and talk to them. I couldn't do that before. If I did, I was in tears. This whole thing literally gave me my life back. Literally.
This land was made for you and me. One more time. This land was made for you and me. Good job. Good job.
For more information, visit xstopspacer.com or call 866-581-2717.